If you need to use a reliever inhaler more than 2 or 3 times a week on a regular basis, your asthma is not well controlled. Here are my best health hacks and tips for children with asthma. It also applies to adults. The first is to make sure you are compliant with your preventer inhaler. So this could be a brown inhaler which you take twice a day. It might be one of the newer MART inhalers. So it's got a combination, it's got the maintenance preventer inhaler and a reliever inhaler in one. It can take up to 2 months to really see the full effect of the prevention and maintenance inhalers. And if your asthma is well controlled, then you shouldn't really need to be using your reliever inhaler or the combined inhaler as a reliever that often. If you need to use a reliever inhaler more than 2 or 3 times a week on a regular basis, your asthma is not well controlled. My second health hack is that if you use a pressurized metered dose inhaler, that's an inhaler where when you press the canister it goes psst, and it sprays the medication, then please make sure you are using a spacer. This is because even with perfect technique, you will only be getting about 10% of the drug into your lungs if you put it into your mouth and spray and breathe in at the same time. Whereas using a spacer can increase the efficacy of that drug up to about 60% of the medication actually getting into your lungs, rather than just hitting the roof of your mouth, the back of your throat, your tongue, etc. My third health hack is that particularly in children, please make sure you are using a peak expiratory flow rate meter or a peak flow diary to really assess the efficacy of the medication and the treatment, because ideally, if you're using prevention inhalers, we want to be able to see those peak flow readings improving over time, and also after you've needed to use the inhaler as a reliever compared with before when you might be having an asthma attack. The fourth hack is to always make sure that you are carrying a reliever inhaler with you at all times, because you have no idea when you will or won't get an asthma attack. And finally, number 5, eczema, asthma, hay fever are all related, and sometimes when your hay fever is getting worse, it can trigger asthma attacks. And there is even something called thunderstorm asthma, which is a combination of hay fever and asthma, and it can create horrendous asthma attacks.